This video has been created for educational purposes only. It is recommended for those who are interested in scientific and medical research. First, for a claimer. And the claimer is, the information in this video is culled from research papers which have been published in peer-reviewed scientific or medical journals. And now for the disclaimer. The disclaimer is that this video is not medical advice, nor does it overrule or suggest to defy any regulatory restrictions in your areas. Please listen to this and read what is on the screen carefully. You can stop the video and make sure you understand these 2 points, the claimer as well as the disclaimer. If you agree and understand these terms, please proceed further. Hello friends, welcome back. You might have heard the proverb in English, give the dog a bad name, then hang him. This proverb came into existence sometime early or middle 18th century because animal activists were very active and they wanted to prevent cruelty to animals. So even if somebody wanted to put down an annoying beast, was to call him a mad dog. This video is about masks in COVID times. I am reminded of the famous words of a Canadian novelist who is not in this world anymore, Andre Berthiaume, who said, "We all wear masks, and the time comes when we cannot remove them without removing some of our own skin." The positions taken by various authorities, people, activists, and the laypersons have now hardened so much, and deep boundary lines have been drawn, that it is difficult to view masks with dispassion or in a scientific way. This particular video is about taking a look at it with the scientific evidence that is presented by researchers across the world. I will now remind you of an English figure of speech, the oxymoron. It is the use of two conflicting words to describe something. For example, this painting is pretty ugly. Pretty and ugly are two opposite terms. You can find so many more. For example, an open secret. Clearly confused. Seriously funny. Deafening silence. Or even found missing. If you have found something, how can that be missing? But then that's what an oxymoron is. Let us now examine the name of the virus that is held responsible for the disease called COVID-19. The alphabets that are used in the acronym stand for severe acute respiratory syndrome. And they further describe that particular virus as a coronavirus 2. That's what makes its name SARS-CoV-2. Let us explore the first alphabet in that name, severe. What exactly do we mean by severe? Severe is something that is serious, grave, or intense. You can use that to describe a state of health or a disease. Yet, in the case of COVID-19, 99% of the cases are asymptomatic or simply mild. Doesn't it contradict the name? Shall we call it a scientific oxymoron? Isn't it the same thing as giving a dog a bad name? And then you know what to do with such a dog. You hang it. The first thing that we are told is how infective this particular condition is. Let us see what scientific papers have to say about it. In the case of asymptomatic persons, that means those who have tested positive and do not have any symptoms of the so-called disease. This is the paper that I'm quoting from, and it is a recent paper of 2020. The paper says that among asymptomatic individuals, there was no droplets or aerosols coronavirus detected from any participant with or without the mask, suggesting that asymptomatic individuals do not transmit or infect other people, quite contrary to the popular belief. The next question that we need to ask is, what about the infectivity from symptomatic persons, people who are exhibiting symptoms of some kind of disease? Once again, you can refer to this paper and what it has to say, that they found that among symptomatic individuals, that means those with fever, cough, sore throat, runny nose, etc., there was no difference between wearing and not wearing a face mask for corona droplets transmission of particles of more than 5 micrometers. Then what about the infectivity due to exposure? Once again, in a study which I quoted earlier, and this is the reference for that, it was found that 445 asymptomatic individuals were exposed to asymptomatic SARS-CoV-2 carriers. That means those who were positive for the virus using close contact. How close? Shared quarantine space for a median of 4 to 5 days. The study found that none of the 445 individuals was infected with the SARS-CoV-2 virus, which was confirmed by real-time reverse transcription polymerase test. By now, all of you must be familiar with that term, the RT-PCR test. So what about comparing a situation where people don't wear any mask, a no mask, a surgical mask, and a famous N95 respirator mask? Well, here is one study which stated that meta-analysis among healthcare workers. Meta-analysis means it has studied various different observational studies, which in this case is 23 observational studies, which included 6 blind randomized control trials. And what they found was there was no protective effect of a medical mask or an N95 respirator against a SARS virus. Here is another study, the reference for which is shown on the screen. It's a 2020 study, and this is also a meta-analysis of 39 studies which covered a total of 33,867 participants. And what they found was there's no difference between N95 respirators versus surgical masks and surgical mask versus no mask in the risk for developing influenza or influenza-like illnesses. As a matter of fact, you will find it very interesting if you go through the fine print of a World Health Organization paper referred here. This was regarding the advice on use of masks in the context of COVID-19. What it said was that due to the low filtration, breathability, and overall performance of fabric face masks, the usage of woven fabric masks such as cloth and or non-woven fabrics should only be considered for infected persons and not for prevention practice in asymptomatic individuals. So the universal usage of masks is of little value actually. As a matter of fact, it has a host of adverse effects as we shall see shortly. At this point, I would like to encourage you to refer to these scientific papers which are available on the internet, and they will unmask the masks. Here is a list of these. You can stop the video, take a note of these, and explore on your own. So far, we have considered what the face masks do not do in a COVID-19 situation. Let's now take a look at what masks can do. What masks actually do is restrict breathing. They can cause hypoxemia, hypercapnia. They increase respiratory complications. There is also a tremendous risk of self-contamination, and they always exacerbate existing chronic conditions, something you should always take into consideration when you are looking at the adverse effects of face masks. All of us should actually know the physiological, psychological, and other health consequences of wearing masks. What you'll see in the next few slides is a brief summary from yet another scientific paper. If you look at the physiological, we have spoken about hypoxemia, hypercapnia, and shortness of breath. The psychological effects are that they activate your stress response, which is the flight or fight response. And staying in this condition for extended periods has consequences. They will dispose you or predispose you for viral and infectious sicknesses and disease. Exactly the opposite of what the masks are supposed to do. Continuing further, the other physiological effects are toxicity, inflammation, and immunosuppression, with the consequences of psychological effects like fear, mood disturbances, fatigue, compromised cognitive performance. And the consequences to health are depression, hypertension, cardiovascular disease, or premature mortality, which means early death. The physiological, psychological, and health consequences don't just stop there. You can also end up with acidosis and increased lactate levels, with the psychological effects of chronic stress conditions. And they can manifest as headaches or anxiety. Of the various adverse effects, here is some research on the effect of using masks. This is the reference to the study, and what this study has to say is they studied 53 surgeons who were wearing surgical face masks. After 60 minutes of face mask wearing, the oxygen saturation dropped by more than 1% and the heart rate increased by approximately 5 beats a minute. This was when they were doing a major operation. This is another study which is specifically for workers who were dealing with COVID-19 situation. And what was found was that 158 health workers who were studied and who were using protective personal equipment, the PPEs, primarily N95 face masks, they reported, or 81% of them developed new headaches during their work shifts as these became mandatory due to the COVID-19 outbreak. For those who use the N95 face mask greater than 4 hours per day, the likelihood for developing a headache during the work shift was approximately 4 times higher. Not a very good situation for somebody who is taking care of the sick. Yet another fact that is often overlooked is the adverse effect of isolation that happens when you are wearing masks in a community setting. Here is one paper, and what it has found is that an umbrella review of 40 systematic reviews, this is not an isolated study, this is 40 systematic reviews which included 10 meta-analyses, demonstrated that compromised social relationships were associated with the increased risk of all-cause mortality, which means death, depression, anxiety suicide, cancer, and overall physical illness. This is the price you pay of isolation. Let me now summarize what we have seen in this video based on published scientific medical research. The first point to note is that both medical and non-medical face masks are ineffective to block human-to-human transmission of viral and infectious disease such as the SARS-CoV-2 and COVID-19. The second takeaway point is that there is substantial adverse physiological and psychological price to pay. This includes hypoxia, hypercapnia, shortness of breath, increased acidity, toxicity, activation of fear and stress response, which results in a rise in stress hormones, which in turn manifests as immunosuppression, fatigue, headaches, decline in cognitive performance, which means your thinking process can also be damaged, and it predisposes you to further infection, causing chronic stress, anxiety, and depression. Not a happy situation at all. The third key takeaway point is about the long-term consequences of wearing face masks. This can cause deterioration of health, and if it is continued to develop, there is further progression of chronic diseases, and in fact it can result in premature death.